built from word parts. Abdominal, pertaining to the abdomen. Anal, pertaining to the anus. Aphasia, without swallowing or the inability to swallow. Celiac, pertaining to the abdomen. Colorectal, pertaining to the colon and rectum. Duodenal, pertaining to the duodenum. Dyspepsia, difficult digestion. Dysphagia, difficult swallowing. Enteropathy, disease of the intestine. Esophageal, pertaining to the esophagus. Gastric, pertaining to the stomach. Gastroenterologist, physician who studies and treats diseases of the stomach and intestines. Gastroenterology, study of the disease in intestines. Study of the stomach and intestines. Gastromalacia, softening of the stomach. Hepatomegaly, enlargement of the liver. Ileocecal, pertaining to the ileum and cecum. Nasogastric, pertaining to the nose and stomach. Oral, pertaining to the mouth. Orogastric, pertaining to the mouth and stomach. Pancreatic, pertaining to the pancreas. Peritoneal, pertaining to the peritoneum. Proctology, study of the rectum. Rectal, pertaining to the rectum. Steatorrhea, discharge of fat, excessive fat, amount of fat in the stool causing frothy, foul-smelling fecal matter, usually associated with the malabsorption of fat in conditions such as chronic pancreatitis and celiac disease. Steatosis, abnormal condition of fat, increased fat at the cellular level, often affecting the liver. Stomatitis, inflammation of the mouth. Sublingual, pertaining to under the tongue. So, name the specialty and specialist likely to be performing this endoscopic exam. So, the specialty would be gastroenterology, and the person would be the gastroenterologist. So now let's look at procto and recto as combining forms. As we learned, they both mean rectum, but again, it's just going to take time and practice to understand when you should use procto and when you should use rectum. It's just going to come with time and practice, though. So procto terms, we have inflammation of the rectum, which is proctitis. Instrument used for visual examination of the rectum would be your proctoscope. Visual examination of the rectum, proctoscopy. Study of the rectum, proctology. And then using recto as your combining form, protrusion of the rectum, rectocele. Pertaining to the colon and rectum, colorectal. Pertaining to the rectum, rectal. So now let's look at complementary terms not built from word parts. Ascites, abnormal collection of fluid in the peritoneal cavity. Diarrhea, frequent discharge of liquid stool. Dysentery, disorder that involves inflammation of the intestine, usually the large intestine, associated with abdominal pain, diarrhea that is often bloody. Emesis, expelling matter from the stomach through the mouth, also called vomiting. Feces, waste from the gastrointestinal tract expelled through the rectum, also called stool or fecal matter. Flatus, gas in the gastrointestinal tract or expelled through the anus. Gastric lavage, washing out of the stomach. Gavage, process of feeding a person through a tube. Hematemesis, vomiting of blood. Hematochezia, passage of visibly bloody feces. Malabsorption, impaired digestion or intestinal absorption of nutrients. Melena, black tarry stool that contains digested blood, usually a result of bleeding in the upper GI tract. Nausea, urge to vomit. Palpate, to examine by hand to feel. Peristalsis, involuntary wave-like contractions that propel food along the gastrointestinal tract. Reflux, abnormal backward flow. In esophageal reflux, the stomach contents flow back into the esophagus. Stoma, surgical opening between an organ and the surface of the body, such as an opening established in the abdominal wall for colostomy, ileostomy, or a similar operation. So here we have a slide on hematochezia. This is a complementary term not built from word parts. Why are we likely to know something about its definition if we forget, though? Because again, even though it's not built from word parts, sometimes they do have words that do resemble combining forms. So hemato, we learned, is blood. The ending ia is diseased or abnormal state or condition of. So if you forget what it means, hopefully you will know that it has to do with something with blood and in a normal condition. And if you know what kizo is Greek for feces, you will get closer to the actual definition then, which is the passage of visibly bloody feces, so you can see blood in your stool. Symptoms of acute gastrointestinal bleeding. These are all terms that we've gone over now. Melena is the black tarry stool that contains digested blood. Hematokiza, passage of visibly bloody feces. And hematemesis, vomiting of blood. And then true or false, is emesis a synonym with vomiting? And hopefully you chose true because it is, and that will end this recording.